When the pandemic hit, and I always think of it hitting kind of in March. I know it was hitting in different parts of the world, perhaps a little bit sooner than that, but things really stopped in March 2020 for us. And by April 1st, working with my counterpart, Jeremy Grimshaw, we had stood up a new initiative called COVID-19, the COVID-19 Evidence Network to support decision making. And we brought together 40 of the leading evidence synthesis teams across Canada. And as questions emerged during COVID about how do we deal with clinical management challenges, how do we deal with the public health measures that were being put in place, how do we help the health system respond during incredible peaks of COVID cases, how do we support the economic and social response, we worked with those teams to rapidly get the best evidence available and summarized and then into the hands of decision makers. So it was an incredibly busy time. We also work globally to try to foster cooperation among similar groups in a variety of other countries and worked with about 60 of the world's leading evidence synthesis, technology assessment, and guideline groups to again help each other build on one another's work and not reinvent the wheel, because so many countries were grappling with similar questions. The other thing that really took off during those COVID years was 1 year into COVID end. So now we're talking April 2021. Many of us were starting to realize that COVID was a game changer for how we thought about using evidence. We were seeing lots of new innovations coming on board, and it was the most demand that we had ever seen coming from senior leaders and citizens for the best evidence. So we created what is called the Global Commission on Evidence to Address Societal Challenges in April 2021, brought together 25 commissioners from around the globe, all regions, all sectors, all types of decision makers, and came out with a report in January of 2022, kind of giving people a sense of how we could do better, both during future global crises, but also during routine times. And then since then, we've been working with many of the same global groups, and now I think have about 80 members of the Global Evidence Commission's Implementation Council with whom we're working on a set of priorities to make sure we're much better prepared in future for crises, but also as we go back to the vast array of current challenges we face, including climate change, how do we make sure that we're really optimized in terms of how we get evidence into the hand of decision makers? So yes, a lot of people slowed down during COVID. We went into overdrive, both with the immediate COVID-19 evidence response, but also trying to shape a future in which we're much better prepared for those kinds of situations.